what's up, people? Welcome to HealthSparx, featuring the brightest entrepreneurs and innovations from the health and technology arena. I am your host, Michael Walsh. Thanks so much for stopping by. Got a great show today. It's Lorianne Rickard, the founding partner of Rickard and Associates. It's a law firm up in Michigan. Lorianne is a healthcare lawyer. She's been in the industry about 30 years or so she's got all sorts of great stuff to share for entrepreneurs out there who are getting into the health and technology space right now. She's got lots of great advice, lots of things to say. She's seen tons of stuff over the last 30 years. So very much looking forward to getting some insight from her and hearing some stories and talk a little bit about kind of how health has changed over the last 5-10 years and kind of where we're going from here. So excited to have her. Thanks so much for stopping by to check everything out with me. So a couple quick reminders before we get started. As always, make sure you subscribe on the website here or go to healthsparx.com/subscribe. I will deliver all the episodes straight to your inbox so that you don't have to be checking back every Tuesday morning when I post episodes, as well as some other stuff that I'm putting together for you guys, tips, advice, packages, perks, other neat stuff like that. So be sure to join the HealthSparx mailing list, and I'll deliver all that stuff straight to you. Also, of course, want to give another shout out to Satori Tech Solutions, who every week I talk to these guys, and it's a pleasure working with them. They do amazing work for me, for CareLoop, for HealthSparx, for Health 2.0 Dallas. So if you are one of those entrepreneurs out there thinking about launching a product and you need an IT team to build you a website, build you a mobile product, do your SEO or your social media work, these are the people you want to call. So happy to make an introduction for you. Just reach out to me here on the website, or you can reach out to them directly. Go to their website, satoritechsolutions.com. So I think that's about it. Really excited for the show. Let's get into it. All right, today on HealthSparx, I have Lorianne Rickard, my first legal expert guest. So excited to have her here on the show today. She's joining us from Michigan. She's here to talk about all sorts of stuff that has been going on in healthcare the last couple years, and really all the buzzwords that we're kind of talking about now, so that all you entrepreneurs out there can really be thinking about some of these things as you build your products and launch your services. So Lorianne, welcome to HealthSparx. How are you?
I'm great. Thank you for having me, Michael.
Yeah, so excited that you're here. So much to talk about, but before we kind of get into a lot of the legal stuff that we're going to get into today, let's set the scene a little bit. Let's talk about you. So give us a little bit of background about you and kind of where you came from.
Well, I am the daughter of a Methodist minister. All of my siblings are lawyers. I'm the youngest. I've been practicing in healthcare for about 27 years. I practice, my law practice is in Michigan, although we practice throughout the country. I'm also admitted in Florida.
Okay.
I started off my practice from law school at a large law firm in Detroit. Its now name is Clark Hill. It was Clark Klein and Beaumont when I joined them. I became a partner there, and shortly after I made partner, I became corporate counsel for St. John Health System, which is now a part of the Ascension Hospitals, which is the largest Catholic health system in the country.
I was going to say, they are huge.
Yep, they're all over the country now, and back in the day, I can tell you I sat in a small boardroom on the corner of the east side of Detroit, and we kind of came up with that idea of a merger with a lot of very entrepreneurial healthcare people who are now running Ascension. So
awesome.
It was a fun thing to be a part of from the inception.
Awesome. Okay, so St. John, so corporate counsel. So you were there, 8 years you said?
I was there from 1993 until 2000 when I left to start my own law firm, which I have continued to do through today.
So I got to ask you, this is always a fun question to ask entrepreneurs. Did you see yourself as an entrepreneur? All those years that you were working as at corporate counsel or working as a partner for a law firm, did you see yourself as an entrepreneur launching your own firm?
Yeah, I think, I always tell people I'm pretty much, when I was in high school, I wanted to be a personnel director, and that's really all I am today. I've always managed a lot of different people and their issues and their crises. And, I have a specific niche in healthcare, but I really don't see my role today as much different than my role when I was running the legal department that had, millions of dollars of budget. Everybody, when they generally come into my office, it's, as I say, not generally a good day. And they're looking for some help and assistance in the things that they need. So I think just being a lawyer is very entrepreneurial, and the only difference now is that, I kind of am lucky. I get to pick and choose who I represent. When you're in-house, you have the clients are kind of assigned to you, and I had 20,000 physicians that thought I was their lawyer, whereas now I can occasionally say I'm too busy and pick and choose the type of things I want to do.
Right. Well, and you know what? I feel like that's a good answer. I feel like if your answer is that you feel like nothing's really changed, regardless of whether you own your own firm or not, that means you really like what you do, right?
Right. And I definitely do. I think there's lots of people who are considering practicing law these days, and many people get turned away because there's a lot of lawyers, but I really couldn't ever imagine doing anything different. I'm very lucky to love what I do.
Yeah, so I'm curious. You're my first guest from Michigan too. I mean, even really, I think from the Midwest. What's the healthcare landscape like there in Michigan, where your firm is?
It's very much in turmoil, like most other parts of the country.
Okay.
The Accountable Care Act, is now rolls off most everybody's tongue,
Right.
Which was not true 27 years ago. I mean, 27 years ago when I started, we referred to healthcare law as the kinder, gentler way to practice law. I mean, you took care of families who were trying to decide, how to care for grandma, and, handled medical records. And, now we are regularly dealing with U.S. attorneys and FBI agents and a variety of other things. So it's just very much exploded. I think there's a lot of change and, quite frankly, a lot of opportunities for entrepreneurs throughout the country if they understand the business of healthcare.
Absolutely. And I want to spend the majority of the time talking about that. But before we go into that a little bit, I also want to just give you a chance to explain a little bit more about what your firm does, just so people are completely aware of it. So the firm that you've built now over the past 12, 13 years, what do you guys mainly focus on? What's your bread and butter type of work?
Well, we are mostly we're known as a healthcare firm, although there are lawyers in the firm that do general practice. But when you think about a corporate healthcare lawyer, it's really a corporate lawyer that handles lots of different things that come up for a business. They just tend to be businesses that are in healthcare.
Sure.
So healthcare businesses have employees, and so they need help with dealing with employee issues. They have regulatory issues. One of the things that we're very well known for is negotiating contracts, which I spend a lot of my time doing.
Sure.
So a physician might be negotiating a contract with a health system. A health system might be talking about a merger with another type of healthcare provider. It really, covers the gamut from, leasing real estate where they've got to have their businesses, but all in the context of healthcare, which has some very specific regulatory issues related to it. So you can't just have anybody do those things without potentially running afoul of some of the laws that keep us all busy trying to update ourselves with.
Absolutely. I was actually just going to ask you, have you done any HIPAA reviews or any HIPAA cases like that for any of your clients?
We actually were just involved with a large breach here in Michigan of an IT provider, and we're very involved in that litigation. We often are doing litigation involving a lot of the regulatory issues when, you hope you fix things before it becomes involved in litigation, but sometimes you have to deal with it after the fact. So we do a lot of HIPAA reviews. I've written books on HIPAA, so we are often doing forms for people, and I do a lot of employee training as well, because that's required by the laws as well to keep your employees updated on such things.
Sure. So you just kind of touched on it a little while ago, and this is a good sort of opening to the real meat and potatoes of the discussion of the day. How has healthcare, in your opinion, changed, both for the good and for the bad here over the last, like, let's say 5 to 10 years? I mean, with the evolution of the internet and social media and all the information that is accessible out there, electronic health records, all the things that we've seen change from a technology standpoint in healthcare. I mean, there's a lot that's happened. So to you, what has been the biggest positive and negative change to all this as it pertains to healthcare?
Well, I think the biggest positive has to do with the interconnectivity of, the communication amongst providers. Any patient who has ever participated in healthcare, which for most of us is everybody,
right.
It really finds that the old way of doing things in healthcare was to find a specialist in each and everything, and you often felt like that activity was not coordinated.
Right.
We'll often talk to people about the fact that we need to know that we're diagnosing an elephant, not just pieces and parts of the elephant.
Yep.
And so the social media, the technology, all of those things have really assisted with helping us do some things that even 5 years ago would have been just unthinkable. But with that, it's like when I was a young lawyer, we didn't have computers. That's how old I am.
Things have changed a little there.
Right. And, we would literally sit in a room with the other lawyers and ask ourselves whether we had time to change this portion of an appellate brief because it needed to go into typing and get word processed to get it to the Court of Appeals in time.
Wow.
That same discussion is now happening in healthcare. It was impossible to think about getting an electronic medical record even 5 years ago. And
right.
The products that we talked about 5-7 years ago, when I was at St. John and we were buying huge IT systems, the things that we were talking about and the importance of those things just for supplies and things like that for managing that type of thing is light years apart from what we're talking about now with the fact that, we've really got to monitor electronic medical records and medical information in texting on the iPhones and
yep.
Communicating across the internet. I mean, it has taken such a lightning pace speed that the issues that arise are things that, quite frankly, we weren't even talking about 3-4 years ago because the opportunities didn't even exist.
And the interesting thing about it is that as all of this has happened, you just said it a second ago too, you at least alluded to it, that like these are issues in healthcare that other industries have dealt with like 10, 15 years ago,
Right.
Like they figured them out already, and now healthcare is just finally getting around to, dotting some of their I's and crossing some of their T's with this stuff. So the answers are out there. It's just a matter of taking those answers and applying them to healthcare, right?
Right. I think, one of the major differences in healthcare is that although, healthcare providers would like to think that their client is the patient, in most instances, the client is a payor, the
Yep.
person who's going to pay the bill.
Right.
And those are huge organizations like the federal government that doesn't tend to move in a very stealth manner.
Right.
And that's very frustrating for healthcare providers that really went into the industry because they wanted to help patients. And I always say to them, great, as long as you don't want to get paid. If you want to get paid, we have to fit within the rules and regulations that these big payors have set out for us. So somehow we have to have a merging of both, like you say, all this wonderful technology that exists and does, amazingly well in other industries that the healthcare providers haven't been as quick to embrace and can't necessarily pay for in the same way as, somebody in Silicon Valley can pay for.
Yeah. And doesn't that just break your heart a little bit too? Like, again, these healthcare providers, these are people that most oftentimes they're doctors, they're nurses, like the social work, whoever they are, they've dedicated their lives to helping people and they want to start a business to do so. But the problem is they don't speak business and they don't understand a lot of times like, yeah, how to get paid or how to like process claims. And they end up like not being able to really make it because they're not there. Like
right.
There's a huge disconnect there. So yeah, absolutely heartbreaking sometimes to hear some of these stories about like good people doing good work, and because they don't understand or they haven't set the system up correctly to get paid, that they're not going to make it. So yeah, really, really tough stuff with some of this. So completely agreed. So I'm curious, you mentioned a second ago about social media. I wanted to get your opinion. Is this a good thing? Is this like on the whole, is it a good thing for healthcare?
I think it is. I think that, like with all of the issues that you just raised, I think people really, really need to understand the environment in which they find themselves, and that is very confidential information that, if you're the patient, you expect the healthcare provider to keep confidential. So I think social media can really be helpful for us all to find quicker, easier ways to communicate with each other. But I think, again, and you could say this about any area of being entrepreneurial in a healthcare environment, you have to be really, really sensitive to what industry you're in. Right. And understanding that although those tools are good tools, that if you're the one that has a breach, if you're the one that doesn't follow the regulations correctly, it really, for the people that I've had to counsel in those environments, it's a really bad day if you kind of jump ahead of yourself and start implementing things. The simple example I used to give was, it's an easy thing in other industries, if you're in the construction industry, to take your client who gives you business to a hockey game and give them some hockey tickets. Mm-hmm. That is actually likely to be against federal law in the healthcare environment. And it doesn't easily translate. It's not obvious to you, It's
just a situation like where you're not allowed to give gifts to vendors?
Well, you're not allowed to give gifts in an instance where a patient, or like, say, your hospital and you want a doctor to admit patients at your hospital. You couldn't say, use my x-ray machine, use my hospital, and here's a gift to get the referral for those patients. Because remember, again, somebody's paying for that admission to that hospital or the use of that x-ray machine, and those payers want to know that the doctor is sending them to your hospital or to your x-ray machine because you're the best place and the most reasonable place to send, not because you're doing it because you get hockey tickets.
And that's an awesome segue too. I was just going to ask you some of your thoughts about just the Affordable Care Act and healthcare reform and everything. But it's a good point to also bring up about insurance, health insurance reform as well. So I was curious just what your thoughts are on all of this. That it's healthcare reform has started rolling out a lot of its tidbits, I guess is a good way to put it, this year, the last like 6-8 months. What are your thoughts on all of this? Kind of what are you seeing with some of your clients and how they're reacting to it, and how it's all coming together, what it's going to mean? I know it's a big blanket question, but just what are your thoughts on all this?
I mean, there's certainly a lot of turmoil throughout the country over the Affordable Care Act, and people have very strong opinions, both pro and con. What I'll tell you from somebody who's been involved in and around the industry for 27 years, there's got to be some changes in healthcare, and whether you like it or you don't like it, I always believe that change is good. And what I know for sure is we can't continue to do things the same way. You wouldn't go into Starbucks and ask Starbucks to exist if every third or fourth person in that line at Starbucks could order anything in the store, and Starbucks wouldn't be able to charge for it. And that's the way healthcare currently is structured. If you have an emergency and you go into the ER, those nonprofits have to provide you whatever level of care you need for free. and no industry can survive that indefinitely.
Totally.
And we're lucky to be in the United States where we have fabulous medical care. And as you say, we have tons of people who really have given up their whole lives for the care of patients. But we have to be able to provide them a system where they're paid something for the care that they provide, and that they aren't required, depending on their location, to provide more free medical services than other of their competitors. And so as we move through this process of change, I think we'll, like all things we've come to in the United States, we'll come to the right answer. It won't be pretty, but I think the fact that we're tackling these things, we're tackling the ideas of an electronic medical record, the ability for a patient to move from one hospital to another. You see the tornadoes in Oklahoma, they had an electronic medical record now due to the incentives from the federal government encouraging people to do that. The patients were moved to another hospital and their medical records were maintained. I mean, that is progress, and that is huge progress from where we were 3 or 4 years ago. So I think it's you wish there was a smoother process, but change tends not to be pretty in my experience.
And I'm in complete agreement with you on this, just because it's like I've been back and forth between Texas and Chicago, so I get the very liberal point of view and the very conservative point of view, all year round. But my continued response to all of it is that, do we really want to keep going the same way we've been going? And the answer to that is no. So regardless of, what the federal government is saying or not saying, something's got to change. So it's a step in the right direction. There's a lot that still needs to be worked out. It's not perfect, but nothing ever is the first time. So it's good to hear that, at least from the legal side of things, and with 27 plus years, 30 years experience, that you're looking at it that same way, that, it's not going to be perfect, but we'll keep working on it. And there are things to take away from at least trying something new.
Right.
So, okay, let's take that even a little step further. Given all of this and how the landscape has changed over the last 5 to 10 years and everything going on right now with healthcare reform, what are the real big opportunities out there for entrepreneurs and startup companies to be focusing on right now? I mean, you deal with clients day in, week and month out. You see all these things and all the things that these people are dealing with, the problems that come up. Where should entrepreneurs be looking right now? Where are the real opportunities for them to go and fix something that's just really, really badly broken and needing attention?
Well, I think going back to some of the things we talked about earlier, anything that could assist with continuity of care from one provider to another would be certainly helpful. The electronic medical record, I think, has a long way to go. The EMRs, the EHRs that we saw even 5 years ago, really, quite frankly, don't even exist anymore. There's some significant things that need to be done, in my opinion. I'm also a certified professional coder and a certified professional auditor for both hospital and ambulance and physician records.
Damn, really?
Yeah. So, I think, we need to take the bright minds of the entrepreneurs working in and around this area and get them to really think about how can we bill easier? What are some efficiencies that can be achieved? How can we monitor our own progress? There should be easier ways for people to figure out how to bill and code medical records and do it correctly. I think as things get to be more electronic in nature, it's amazing what people can do with data then to help people who are really very busy at what they do, providing care, to have systems that are just much more helpful in the process. My dad's 91. He has a full-time healthcare lawyer and 3 other lawyers in the family to assist him when he goes from a healthcare provider to the next healthcare provider. it should be that you should be able to have any job and not have an extended family and be able to carry your records with you from place to place. That you,
it's you can do it with anything else, right?
So you don't have drug interactions. So the cardiac doctors know what the status of your kidneys are. All of those things. And quite frankly, it's really, really hard. And I see so many people of my generation, the boomers, trying to deal with both their elderly parents or their own health care. And I think that we really need to make some progress in that area. And I think there's tons of opportunities for entrepreneurs in that area. And I also think that, other opportunities for ease of training in some of these very complex healthcare environments. I mean, we train large companies of people to do amazing things. And I think if we could see those training modules come into healthcare, it would be very helpful as well. So, I mean, we could talk about that indefinitely because there's most things are broken and need fixing in healthcare right now, especially as we transition to this new model. And if the Accountable Care Act is implemented throughout the country, you're going to have a huge amount of people getting care that weren't getting care in the past. And so I think the efficiencies will be even more important.
Absolutely. And just saying all this, you're making me wonder, have you ever been on any startup company board of directors or board of advisors?
I have not. I often advise healthcare companies when they're going into other areas that they might not have gone into before, but I participated in a startup. That would be a new challenge, I think.
Yeah, I'm just curious because again, and especially to those of you listening, it seems Lorianne, she's seen some things and she's got some great ideas. So I wouldn't be surprised if you got a couple of emails or hopefully at least from the show being like, hey, we need to talk because you got some great stuff to say. So, a good maybe wrap-up question for you, just again, you being that entrepreneurial type of spirit, starting your own firm and kind of being a part of the industry for so long. What's been the biggest challenge of running your own shop, if you don't mind me asking?
Well,
what difficulties have you come across?
I think, I like to tell people that, my law firm is my ideal of a perfect job. It was, when do you get to design something that, you really know what you like and what you don't like? And this was intended to be some place that, everybody who worked here loved it. I think the challenge is, as the years go on, to be doing the type of work that we do, which is very stressful. You really have people's lives and businesses in your hands, but also communicate that, it still needs to be that place where you come every day and you really like what you do. So I think, that as I get older and as we grow as a law firm, I like to always try and remember that people spend probably more of their life in and around the people that they work with than maybe even their loved ones. And so it's got to be something that's not only challenging, but something that people really like to do and enjoy doing. And I think the social media part of it, for me at least, is actually part of that. I like to grow. I like to learn new things. And the social media really allows me to communicate with people like yourself who I would have never gotten a chance to talk to. So I think that's both a challenge, but there's a lot of things in the future that seem very exciting.
It's fantastic thoughts and advice. I mean, for anybody out there, that's what we're all trying to create in a way, right? An atmosphere that we can all have a good time with, but also enjoy our passions and really make a difference in the world. And it's pretty clear that you're doing just that up in Michigan. So thank you so much for being a part of the show. This has been fantastic. The advice has been great. For everybody listening, I'll share all of Lorianne's information on the website, on the episode page, so that you can check her out and connect with her on Twitter or LinkedIn or wherever it is that you guys do your business. So again, Lorianne, thank you so much for being a part of the show, and looking forward to chatting with you
Absolutely.
more soon.
Thank you, Michael, for having us.
All right, and that is it for me and Lorianne. Great stuff from her. It was such a pleasure to talk with her. She clearly is an expert in this field. She has seen so much in healthcare change over the years, just so many great things happen. Very grateful to her for coming on the show and sharing all of her insight with all of us. Hope you entrepreneurs and really just anybody out there, hope you guys enjoyed it. This was great stuff. Tons to take away from what she just talked about. So thank you again very much to her for coming. A couple of quick things before we sign off. Of course, make sure you subscribe here on the website. Would love to be able to deliver episodes like this one to your inbox every week. Go to healthsparx.com/subscribe, or just right here on the website, fill out your information, and I'll get that stuff over to you right away. Of course, we're also available on iTunes and Stitcher Radio, so you can check us out and follow us there. And last but not least, I keep asking, send me some feedback, guys. I would love to know how the episodes are going. Do you like the guests? Do you like the website? Do you like the format of the content? Any suggestions, feedback? Please bring it on. I'd love to hear from you. It's always great to kind of take a roll on how things are going, and if there's anything that needs changing. So would really appreciate it. I think that's about it. Until next time, I'm your host, Michael Walsh. Talk to you soon.